Welcome to University Hospital's staff education on the Pregnancy Risk Assessment Form, also known as PRAF. This form is a useful tool that helps us extend patient care beyond the exam room. This brief overview explains what the PRAF is, how it works, and why it matters to patients and to UEH. The PRAF is a Medicaid tool used to identify potential risks to the health and safety of both mom and unborn child. The PRAF serves to notify the Ohio Department of Medicaid and initiates resource connections to help improve the outcome of the patient's pregnancy. This simple action activates a support network that can significantly improve maternal and infant health outcomes. Who qualifies for the Pregnancy Risk Assessment Form? Any patient who has a Medicaid insurance is either a primary or secondary insurance type. Examples include, but are not limited to, Buckeye, CareSource, and Molina. This does not include marketplace insurances with the same company name. How often should a pregnancy risk assessment form be submitted? The initial PRAF should be submitted for every pregnant Medicaid patient. Every pregnancy, every time. Each new pregnancy requires its own initiating PRAF to ensure continuous care. In addition, it can be submitted during any prenatal or postpartum visit when a new medical risk or social need is identified. Examples of changes that prompt a new PRAF include a diagnosis of gestational diabetes, hypertension, or postpartum depression, loss of housing or employment, development of food insecurity, experiences of domestic violence, or an increased EPDS score. A submitted PRAF will guarantee that the patient will maintain Medicaid insurance for the duration of pregnancy and for the 12-month postpartum period for both mom and baby. The PRAF also helps the Ohio Department of Medicaid connect patients with needed social resources, such as a caseworker for care coordination. And because the PRAF covers all pregnancies, even women experiencing pregnancy loss can receive needed supportive care in the postpartum period. The PRAF connects patients to vital resources including WIC, transportation, medication management, addiction services and support, including tobacco cessation, housing, food and utilities support, safety resources such as smoke detectors, home visiting services, and behavioral and mental health services. Let's be clear on what the PRAF does not do. A PRAF will not flag child protective services or other interventions. It does not replace care provided by a provider, and it is not meant to shame the patient. The form is a tool providing support and connection. The PRAF benefits university hospitals too. Each initial form secures Medicaid coverage for clinical services for the duration of the pregnancy and postpartum period, which reduces the financial burden for UH and patients, supporting equitable access to care. Every submitted PRAF also generates reimbursement from Ohio Medicaid at the current rate of $200 for the initial form and $90 for updates. These funds help sustain and support UH clinical services and expand community-based social programs, enhancing care for all. PRAF reimbursements also help maintain adequate staffing and contribute to job security for care team members. When you complete a pregnancy risk assessment form, you are not just filling out paperwork, you are providing care. You are the bridge between the patient and the resources she may urgently need. By submitting a PRAF, you are helping a mother stay insured, access food, housing, mental health care, and more. You may or may not be in the exam room, but you are absolutely part of her care team. Your actions make a difference, and that makes you her caregiver too. Thank you for supporting our patients and our hospital. Every PRAF submission makes a difference. Every pregnant Medicaid patient, every pregnancy, every time.